Public health emergency for COVID-19 ends next week for Massachusetts and the rest of the country. Here to talk about that, what this means for you, someone we began this whole pandemic with, Dr. Todd Ellerin, Chief of Infectious Diseases at South Shore Health.
All right, Dr. T, it's always great to see you. I'm going to ask you flat out, and you don't know what this is coming. Is this the end of the road, or do we keep going?
All right, so Eddie, you know the public health emergency is going to end, but obviously COVID is not over, right? We're going to see those peaks and valleys. But the bottom line is we are doing so well today. At South Shore Health, at our hospital, we have 0 cases of COVID.
Seriously?
No COVID cases in the ICU, none on the floor. It's really something to celebrate.
It was the same at Tufts, too, right? At Tufts Medical Center announced this morning it no longer has a single patient hospitalized for COVID, right?
It's amazing. Such good news.
It is really good news. Yeah.
The White House pegging Thursday, May 11th, is the official end of the public health emergency. So what does that mean for you? What does that mean for us? What does it mean for South Shore Health? What does this mean?
Right. So again, Maria, the end of the public health emergency, it's a great thing. It means we're in a much better place, but it's not the end of COVID. We still have to be vigilant. We still have to count cases. We still have to look for variants and understand severity. But one of the things that we're all talking about is the fact that there's likely going to be a discontinuation of the mask mandate in Massachusetts. Now, importantly, we're still waiting on the Department of Public Health to see what they say. But remember, each organization independently has to decide what they're going to do. What is South Shore Health going to do? Remember, we have a hospital, we have a medical center in Norwell and in other areas. We have a Dana-Farber Brigham South Shore Hospital Cancer Center right across the street. You can throw a baseball. So it may not be at every organization that on May 11th, we're just going to rip our masks off. We have to be thoughtful about the decision, and we're waiting for our mass DPH response. Also, one other thing, remember, that just because we take our masks off, and not every place might, we also have to think about what happens in the next viral surge. What happens during respiratory season? Are we going to have put masks back on to protect our patients? Remember, we have a culture of safety, and patient safety comes first.
That's a great reminder. So let me expand on something you just brought up, Dr. T. Some COVID vaccines, treatments like, for example, Paxlovid, are authorized only for emergency use. But now that the emergency is ending, will those products disappear?
Now you're going to sort of kind of raise an eyebrow at what I'm going to say, but the FDA is saying that the end of the public health emergency doesn't mean the end of the emergency use authorization. A lot of that is semantics. I think what's important to know is this EUA is just a pathway for the FDA to be able to authorize medications, vaccines during an emergency. The bottom line is these are still going to be available. Whether we call it an EUA or there's another pathway and we term it differently. The vaccines, these antivirals that have been so helpful, have saved so many lives. These are still going to be here and accessible.
And the bottom line is 3+ years since we've been talking to you. Things are much, much better.
Look at that smile on his face. Yeah.
And Maria, I mean,
we had some daunting conversations. We did.
We've had some dark days, and it is light right now.
Well, you helped us get through it, Dr.
You
T.
did.
Brilliant.
We appreciate it.
Stay at the helm, my friend. Great to see you.